What's up, everybody? Welcome to this week's episode of the Well Man's Podcast, episode 200 of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you?
I'm doing wonderful. Yes, episode 200.
That's pretty crazy.
Yeah. So thank you for clicking in, listening to us once again. We really do appreciate it. Please let anyone you know that you think may benefit from the Well Man's Podcast. Please let them know about us. Also, this is called the Well Man's, in quote, podcast, man as in human. So this podcast is also for women. So anybody you think can benefit from it, please
for any
just let them know.
human under the sun.
Yes. We may expand to other human-like species at some point, but
Hopefully,
now just
if we're that lucky, if we really grow, which there are a variety of ways to support us and help us grow, leaving reviews on iTunes, Spotify, wherever you do listen to the show. And then, of course, Keoni and I each have our own business. We have different social media presences where you can follow us there along with the Well Man's Podcast. And on YouTube, liking, commenting, subscribing, that sort of thing, just to help the algorithm, help us help more humans.
Yep. So, I guess everybody knows that's listened to us knows about our podcast. Really, the focus is wellness for the most part, right? Everything about wellness, how to make your life more comfortable, improving your quality of life. And so we talk about specific diseases, illnesses, anatomical stuff, postural stuff, just to help improve your overall wellness. But we thought that this podcast would be good to go back to one of our first podcasts and just talk about wellness and what it means to us and how we determine it through ourselves and how we use it to help our patients. I think it's especially important that we do this now, especially since we've are still dealing with this pandemic with COVID. And as you guys know, we've done a number of COVID podcasts, but wellness is where we usually start. It's the foundation of medicine, as far as I'm concerned. So let's get into it and see if any of this resonates with you guys and how we approach it as doctors.
Yeah, and I do think it's interesting because it was our first podcast episode. It was just what is wellness? And then I don't know, that was in 2017, 2018, something like that. And I think the definition for people really changed because of the pandemic. We were forced in different situations. We really got to take a nice solid look at our health and what wellness really means to us, even throw in things, the Great Resignation and things like that. And people really kind of understanding a little bit more about what wellness means to them and how that impacts their life as a whole and what goes into that.
Right. And, we're geared towards, me and you were geared towards like natural medicine type approaches to wellness, but wellness is so much more than that. Especially with this pandemic, we realized quickly that yes, taking care of yourself, taking certain types of supplements and stuff like that can certainly help. But by far, what we found is getting vaccinated, doing your hygiene, preventative stuff is one of the things that really is helping to put the brakes on this pandemic. I say brakes because it seems like it's just going on and on forever. But talking about saving lives, conventional medicine certainly has helped us with that. So we, I think with our podcast, Brian, I know you agree with this, but we really want to say that medicine is medicine. It doesn't matter whether it's natural or conventional medicine. Use what works,
Mm-hmm.
So, and usually one of the things we stress with wellness is using both is usually the best. Using some evidence-based natural medicine as well as evidence-based conventional medicine. And when you do that, you just see that, your outcomes tend to be a lot better and people improve their wellness and quality of life.
Yeah. Did you, by any chance, can you look up like the definition of wellness?
No, I have my own definition from kind of a naturopathic perspective that I'll go over and how I approach it. What about you?
Well, so I did look it up, but then as you were talking, that was one of my just central points when I was thinking about this topic was your wellness is really defined by you. So, talking about doing what works for you in both conventional, natural type of medicines and finding what works for you, but your wellness is really defined by you. And I think that's kind of what I'm alluding to, even with the pandemic and the Great Resignation, all these things that have happened over the course of the last 2 years, as far as people really understanding us, focusing on our health as a society, but also really getting down to the nitty gritty of what's making you happy, what's making you well, and all of that stuff. But I did look up the definition of wellness. Interesting enough, the first link that had a definition of wellness was from Pfizer. So they stated that wellness is the act of practicing healthy habits on a daily basis to attain better physical and mental health outcomes, so that instead of just surviving, you're thriving.
Right. Yeah, I would agree. I agree with that from the individual perspective, but also wellness has a lot to do with, your network of people, and even beyond that, it goes to the planet. I mean, it's very hard to have a good quality life when, for example, I'm exaggerating this, but using an example, but if you can't breathe clean air, that is an obstacle to wellness. So
we're talking environmental wellness there.
What we're talking about, environmental wellness. Or if you are in a social network where some of the people that are close to you, just have negative energy or don't support you or don't get you or make you feel bad, just whatever that may be. Part of your wellness is creating safe relationships that, help improve you and, bring you up instead of pull you down. So that's another aspect of wellness where outside of yourself, you're very dependent. And I will say, one of the main things of wellness, and as far as morbidity and mortality, is keeping those social connections. Loneliness is a big factor for not being well, and higher rates of morbidity and mortality. So, social connections. I mean, we as humans need those social connections. That's huge. And there's a book out there, we talked about it before, Blue Zones, and that was one of the biggest things that improved longevity, was maintaining good social connections, good social groups and stuff like that. It went way beyond, eating healthy and exercise and stuff like that. And that's, when we talk about social connections, I mean, that stuff is, it doesn't cost much, but it does take effort on people to maintain those, especially in this day and age of, computers and smartphones and things like that. Having a interaction with your friends and family, and the pandemic really did a number on that. Through that, kind of made it harder. Let's put it that way. With the isolation stuff. So that's a
forced us to find it in other ways too.
Right.
Doing this remotely and whatnot, type of stuff.
Yeah. I also think wellness is how you have to, how you are in the world. So for example, for me and as physicians, we take, an oath, like the Hippocratic Oath. One of the first things is primum non nocere, which is first do no harm. And I know, when you have little rules or, kind of a philosophy that you abide by, everybody can define that a little bit different. But for me, first do no harm leads me into thinking, okay, what is my true expertise? So I am trained, I'm trained as a primary care physician with a focus in natural medicine, evidence-based natural medicine. And then, so knowing what my expertise is, I should also know what my limitations are, right? Yeah. So I am not, I am not an expert in physical therapy like you are, Brian, so my patients, if they need a physical therapist, I need to, relying on that first do no harm, I need to know when to refer out. I need to know when to refer out when I can't help you, or you're going to be better helped by somebody else as a physician. It also applies to me. This is one of the reasons why I just tend to, until they say otherwise or until the mandates are lifted, I just wear a mask out in public now. When I go anywhere, I just do. And it's not so, I'm not so worried about myself with that. I'm more worried that there's so many, especially with this pandemic, we just don't know. Like, I could be a carrier, there's so much we don't know about this virus. So that's another thing that I deal with first, do no harm. It's like, it's not so much about, myself, even though by doing that and doing hygiene practices and all that stuff will help me, but more so it's going to help others around me. And I feel like that's part of my civic duty. Now, we can get into this whole thing, whether masks work or they don't. I mean, I looked at the research, and my opinion of the research is that masks do work, and the vaccines do much more benefit than harm. So I know we keep harping on the COVID stuff, but it's a really good example to talk about wellness. But anyway, also, I'm not an infectious disease specialist, neither are you, Brian. So I just will tend to defer to them before I defer to, other people's opinions and stuff about health. I want to go to the expert. So
even selfishly, it helps you lay your head down and fall asleep at night for your emotional wellness, just about you're doing the right thing, or doing what you can to do the right thing.
I agree. I mean, we as humans cannot, we cannot fix everything, but we as humans in groups and in teams, I mean, look at what we've done. We've built cities. We built, we built this internet. Nobody could do that by themselves. So anyway, just knowing your limitations is huge as a practitioner of wellness. Knowing when to refer, knowing your expertise, knowing the expertise of others. And then I think a big part of this comes from, and you hit on this, Brian, is, a lot of wellness comes from, like, what is your individual worldview? So for example, if you are like the type of person who is totally against vaccinations, you've done your research, you've done everything you've done, has told you that, this is not the best thing for you, then guess what? Your wellness probably is determined by that to a big extent. Like, forcing you to get a vaccination in some way is probably going to do more harm than good, especially if you believe that. My goal is to just help, it's docere, doctor as teacher, is just to put the information out there as I see it. But I also get, like, part of people's wellness is being able to determine their own wellness. You are your own leader. I'm just, as a healthcare team, if Brian and I are on your healthcare team, or part of it, along with your, other doctors or healthcare providers or personal trainers or whatever, you are the captain of that ship. You determine what you do. So if you determine that, you don't want to get a vaccine, maybe that is a big part of your wellness then. So who am I ultimately to say? I can give you all the data, but who am I ultimately to say that it's not? Even though I would disagree with that, especially if you had the health and didn't have a history of medical stuff. I would just give you the data as I see it and the information as I see it, refer to you. But if you actually ultimately decided that this is what you wanted to do, then I'm going to support that. Same goes with cancer treatment. I had a number of patients who, I disagreed with them. I thought they probably should do conventional cancer treatment along with natural evidence-based, oncology or cancer treatment. But some of my patients said, absolutely not. I've seen what my, so-and-so has gone through, my friend, with chemotherapy. I don't want to do that. And, it's, for me, I meet you where you are with that stuff as best I can.
Yeah. One of my favorite quotes from a yoga teacher that I've really started implementing in my own practice is, I make suggestions, you make decisions. And I think if you really take an active role in your health, and, you can sit back and take a back seat and be healthy, right? Like, a doctor can give you medical science today can keep you alive if you were,
right,
unable to do it yourself, or, in a serious situation. But as far as achieving wellness, it really is something that you have to take an active role and kind of lead from the front. And us as healthcare providers, we see you when we see you for an hour or however long that may be, and you're living in your body 24 hours a day, 7 days a week, 365. And it's really up to you to take our suggestions and then implement on them or make decisions that are best for you to kind of take that active role in your wellness.
Yeah, and it right. And it's not in my nature. I know it's not in yours either, Brian, but it's not in my nature to fire a client because they don't, want to abide by what I recommend. I'm going to meet them where they are,
Right.
But it speaks to, part of my philosophy of wellness medicine is prevention is the best cure, right? So if I can prevent somebody from becoming ill or having a poor quality of life through my recommendations or prescriptions or whatever, then I'm going to recommend that. And so going back to the COVID stuff or just, preventing chronic disease, one of the best preventions for COVID would be, the hygiene stuff, wash your hands, masking, that type of thing. And then part of it is also the vaccination. But another part of that would also be, appropriate sleep, appropriate supplementation, get your vitamin D levels up, whatever else out there natural that you could use that certainly won't hurt you and has at least some evidence or some credence in slowing down or preventing you from getting sick. So, prevention is the best cure. So that's why how many times have we harped on lifestyle stuff, and that's part of our wellness philosophy.
Yeah, absolutely.
And then the other thing is I tell patients part of that is, okay, so let's say you come in and you have some type of illness. Let's say you just been diagnosed with diabetes, so how would we approach that? Well, one of the ways would be, well, I definitely want to treat the symptoms you're dealing with, the signs and symptoms. So diabetes, if you have high blood sugar, let's say it's type 2 diabetes, if you have high blood sugar, then, one of the best ways to bring it down would be to be on some type of diabetes medication. And usually when you're first diagnosed, and we love this med, we talked about it a number of times, Brian, is they put you on metformin. It's a conventional med, you need a prescription for it, but it doesn't stop there. So my goal is to then treat the cause. So what has caused that to happen? So what in your lifestyle is acting like an obstacle to cure or making your sugar levels go up to where you are now diagnosed as a diabetic? Is it lack of exercise? Is it eating too much? Is it eating too many refined carbs? Is it chronic stress? Is it lack of sleep? All of these things play a role. So you want to not only treat the symptoms to make the person more comfortable. Think about somebody who's in pain. So treat the symptoms. Yeah, I want them on some type of pain med, whether it's natural or not. And pain meds, natural ones, we talked a number of times on this, would be something like curcumin or CBD or Delta 8, Delta 10, anything that decreases inflammation and then also magnesium to some extent too, and has a little analgesic effect. If that doesn't touch it and you're in a lot of pain, then of course I want you on something more powerful, like an NSAID, possibly an opioid medication. And then you go and treat the cause, whether it's a structural thing going on in the body or whatever it may be. If it's an autoimmune stuff, you go and look for what is putting you out of balance.
The way I've described it to patients before is, and again, it kind of goes back to what I was saying before about difference between being healthy or not in pain, and then difference between well and this not becoming a problem again. It's kind of like, you can manage the signs and symptoms, and that's 100% necessary. And you have to do that to kind of get you to where you want to. It's kind of like if I was installing hardwood floors in your house and I just put the hardwood down and then you said, okay, that's enough because we got the hardwood in, but I didn't actually seal it or coat it with anything that would prevent scratches or make it, solid and sturdy for the duration of how long these hardwood floors are supposed to last. And that's kind of the difference I see between health and wellness, is dealing with the signs and symptoms and making sure you're okay and alive is the health, or dealing with those signs and symptoms and then taking it that extra step to make sure it's not a problem again, or we're addressing the underlying cause, or putting that finishing coating on the hardwood floor to make sure it's not scratched up easily, or whatever the case may be, is taking that next step that's going to make you well.
Yeah. Yeah. And this kind of applies also. So let's say here's an example, a case studies. Somebody comes in, has a, what most people would think is a devastating diagnosis. Let's say the doctor told them they have cancer and it's spread. Okay. That's a scary thing to be confronted with. And, according to your oncologist, the only option is that, you go through chemo treatment and so on and so on. And your oncologist is sitting there, and let's say you're seeing somebody like me, and your oncologist is sitting there saying, well, that natural stuff, doesn't work at all, yada, yada, yada. And then you come to me and I'm telling you, well, I think, based on the treatment, we can also use these natural approaches. We definitely don't want to inhibit any of the conventional treatment, so on and so on. Again, it's a team effort. You are the leader in that, and you can determine what you want to do. But I also tell my patients, don't get so caught up in what one healthcare provider is saying as opposed to another one. I mean, the last thing I want to do as a healthcare provider is add more stress to your life. So for example, if you're taking curcumin, which is a wonderful thing to take for most cancers, and seems to help most chemo drugs, not all. But if you're taking that and your oncologist poo-poos it, I mean, at the very least, one of the things, let's say they say don't do that, and if you were doing that, it just would add more stress to your life. Well, your oncologist isn't going to tell you not to eat turmeric, all right, or it's not going to tell you to eat. Maybe they're concerned about taking an antioxidant multi, but they're not going to be very concerned about you eating a bowl of blueberries. So for me as a physician, it's just meeting you and your team where they are to get the best outcomes. And then the other thing I want to say about this is really important. And it's easier said than done. And, Brian and I have not been through this. At some point, me more likely than Brian, since I'm older than you, Brian, but at some point, either one of us will get a devastating diagnosis about something. Usually for cancer, it's age related. Age is the highest risk factor of cancer. You have two choices there. All right. Let's say worst case scenario, you're given 2 months to live, right? You have two choices. You can take that information and be like, all right, well, that really sucks, and acknowledge that, and, have your angst and, get a good cry out, or whatever you need to do. Or those next 2 months, you can sit there and torture yourself like, I'm going to die, so on and so on, and create more suffering. That is the one thing that I've talked to a number of patients about, like, what can we do to decrease for your wellness with that devastating diagnosis? How can we improve your wellness? And one of the ways is to enjoy the time that you have, and to try to, certainly not minimize your diagnosis, but enjoy the rest of your life without torturing yourself over what is going to come to all of us, no matter our diagnosis. So there's a big mental component to wellness, a big mental component. It's probably the most important thing, I think.
Yeah, absolutely. And it's one thing that's supremely important to me. It's part of my mission statement with my business, but it's kind of instilling this confidence. And so the way I see it, in a lesser diagnosis, but someone goes to the doctor, oh, your knee, your hip is bone on bone, which, by the way, I hope your bones are bone on bone, right? Like, that's how joints are made. The bone connects to the bone and moves on a bone. So they say these words that are like super frightening. And so, right. Okay, your knee's bone on bone, or your hip's bone on bone, you're going to have surgery. And then, kind of just like you said, someone has two choices, and where they're either kind of dejected about it, or they can either, in this situation, you can definitely do something about it. You definitely can play an active role in staving off surgery and whatnot, and instilling that confidence, which goes back to that mental wellness, that either it's confidence, in those situations like you mentioned that are a little bit more drastic, where it's confidence that you can enjoy those 2 months or whatever the case may be, or like with my situation with, a hip, someone's been told that they're going to have an impending hip surgery, blah, 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 blah. It's instilling that confidence that you can do something about it, and you just need to have the tools and the knowledge. And then once you have that, you have the ability to kind of control the pain, the situation, and stave off that surgery. And when people, I really see, a stark contrast just along like seeing people where once they catch on to this confidence that they develop in themselves, where they are now able to, oh, my hip hurts, and I know that these 2 exercises have really worked for me, and I can do these and then decrease my hip pain or get rid of my hip pain. That confidence then just kind of almost like a catalyst for further wellness and just their ability to continue living an active, happy life in the way you were talking about, where it's no longer this doom and gloom. It's, I have the power, I have the confidence to do something about this, and I can. And it just speaks to that mental wellness. And I think confidence is a huge part of that.
Yeah, and you're given control, like, and
Right.
you are the ultimate leader. And there is a big mental game with illness where there's some interesting research. I mean, part of my philosophy is, I wouldn't say I'm a pure materialist, but that is part of my philosophy. But hey, my kind of woo-woo worldview, so to speak, I really do believe, and I see it in the science, that you can heal yourself a lot mentally alone. Like, you can physically speed up your healing. You can physically, with your mental game, really help yourself. I've seen people, like, for example, I was listening to a lecture the other day, somebody on Qigong who had a number of clients, who just through the work of Qigong, really, after given a devastating diagnosis, healed themselves. And we're talking years later after a cancer diagnosis, which I found fascinating. So, I say that because you are the most important component to wellness, not your healthcare team.
Yeah.
You play a big role in the control. If you're with a healthcare provider that kind of takes away that control, I mean, then I would recommend finding another healthcare provider that, doesn't do that.
And we see that research in like the placebo effect. I see it in the clinic all the time.
Oh yeah.
Like the ultrasound machine really doesn't do much, doesn't have great research. I'm not a huge fan of it. But I'll have patients that request it and they think it's, we've done the 7 minutes and they think, wow, everything is so much better. And it's one, who am I as a healthcare provider to not provide that if they believe it is helping them?
Right.
Especially, if they're specifically requesting it even.
Right. And if they believe it, it's going to be more likely to help them anyway.
Yeah, exactly.
So
it just speaks to you. It really is it is defined by you, and it is necessary for you to take an active role in kind of developing your wellness, and that alone will instill confidence and kind of help all these different components, mental, emotional, social, environmental, all these different components, occupational, that we're talking about, as far as that create your personal, Brian Brosey's wellness, Keoni's wellness, all these little things. That's, taking an active role in all of them, and then really taking that active role and being in charge and having that confidence that you can address all these things is really where the wellness that's defined by you is created.
And speaking of just, and I approach it as a physician and how I approach it as, in my own life, is I have this kind of therapeutic order of things that I kind of follow. And in general, this is kind of my philosophy. Follows this. It goes this way. The most powerful medicines tend to be the most non-invasive medicines. They tend to also be the most broad-acting medicines, right? So my therapeutic order, you can think about it as a pyramid with the foundations. We already mentioned this, but the foundation being, okay, family and social connections. Maybe that's your foundational order. Like, is that somewhat in order? Up next level, are you sleeping okay? How's your diet? Are you exercising on a regular basis, and getting plenty of rest in between? And is that exercise, something fun that you enjoy doing, or is it not? Like, you got to take all these things into account. Fasting, these are, level up. Functional foods, cocoa, whey protein, kombucha, fermented foods, goji berries, mushrooms, that's the next level up. Maybe the next level up after that is supplements or enhancers like NAC, curcumin, magnesium, vitamin D. The next level up would be maybe herbal medicines. And remember, we're going from the most powerful, non-invasive to the most broad acting medicines. So then after supplements, maybe think about herbals. After herbals, maybe think about vaccinations or anything conventionally that is to prevent. And then maybe after that, think about prescription meds. And as a physician and also as a healthcare consumer, which we all are, is you just really need to think about, where in that pyramid or in that therapeutic order is going to help you the best. And sometimes you need stuff at the bottom level and you need stuff at the top level, but generally that is my therapeutic order of things. And of course, from that foundation, social connections on up, you also need to know when to, the physician know when to refer to help your patient the best. And also as a consumer, you need to know, have somewhat of an idea of who you need to talk to that's going to give you the most kind of bang for your buck, so to speak. But that's generally my therapeutic order. I mean, is that generally how you follow things? I mean, from a PT's perspective, Brian?
In general, I would say and I'm just going to say for me personally, that foundation is movement, and movement really is medicine. Movement, we see, it stimulates so many different things in your body, whether or not we're talking about like intense workouts and the endorphins you relieve, or even just talking about like negating pain, like we were talking about before. Specific sorts of, movements will reduce pain. They'll stimulate the synovial fluid in your joints, making it more easy for you to move. And just that, for me, like when I'm not moving or I'm not very active, I kind of feel sticky, kind of feel bogged down, versus when I'm limber, lubricated in the joint sense and moved around, I feel an emotional component of that makes me feel more lubricated, easygoing, that sort of thing.
Mentally you're more there, right? You just feel better. You have better sense of well-being.
And so that's obviously towards the bottom of my foundation. It's super important. And I couldn't go without saying that movement really is a part of wellness, whether or not we're looking, like I said, at a super endorphin release from this crazy HIIT workout, or we're just talking about all the great benefits going for a walk, or just stretching and kind of getting some of that synovial fluid moving and feeling fresh, feeling awake, like you're saying.
Movement is key. I mean, we are built to move, and movement, I think you're implying this, Brian, is different than exercise. Like, you need to move. Yeah,
exactly. Great point.
Another component of this for me is reframing how we think about illness and disease. So for example, a lot of time with our healthcare system, it's almost like, well, let's wait until, let's not go see the doctor until
you're unhealthy.
Until I'm unhealthy.
Obviously.
Or this whole notion where, this happened the other day with a patient of mine, it's like, thought he was healthy. I think his doctors even, kind of misguided him a little bit with this. But then he goes see his doctor 1 week, and all of a sudden, boom, he's diabetic, and diabetes doesn't work like that. You don't all of a sudden become healthy and then unhealthy overnight based on a lab test. And a good physician or somebody who is paying attention to health knows that a lot of these chronic illnesses are insidious. So it's like it's daily work to keep yourself healthy and improve your quality of life. And when you do that, as part of this reframing is not wait until you're sick, until you are, have illness or whatever, but also have an idea of, especially with chronic illness, like what is the main component that brings on chronic illness besides lifestyles and stuff? And the main component we talked about this, Brian, is really aging. So what are we really trying to do with improving health and well-being? We want to try to slow down the aging process. And if we focused on that instead of focusing on disease and waiting until you get sick, you're going to be less likely or have lower risk of disease. There are so many ways to, and I wish our healthcare system was based on, instead of management care, but based on, okay, what can we do to slow down aging? If we focused on that, then what we would see is a lot of this chronic disease would be out the window. And most people can relate to that. Most people will be like, look, if I could slow down, have some semblance of the fountain of youth and slow down aging, yeah, then I'd actually do that. Well, to do that, you want to pay attention to, your kind of
well, to me, it's focusing on wellness versus, again, focusing on that kind of acute health.
Yeah.
You have a fever, you got to address it, versus
right.
long-term focusing on being well is going to have that cascade of effects that's going to be positive for improving your lifespan, your longevity, slowing down the aging process.
And I no doubt, but it's really interesting to me when you think about aging. Like you can see, I think I posted something the other day on social media, but it's an 80-year-old woman and they're doing deadlifting her weight, doing pull-ups.
Keeping all of her deadlifting cues. She was listening to our podcast.
Yeah,
Brian,
she must have been because she must have been because her form was was really good. But as opposed to somebody who's 50 years old and has achy joints, is extremely inflamed and diabetic. I mean, when you see something like that, you can reframe it as in saying, well, that 50-year-old is aging much faster than that 80-year-old. And those two, maybe one has a higher chronological age than the other, but the woman at 80 doing deadlifts has a much lower biological age than the 50-year-old. So I just think sometimes reframing what health is in terms of age is helpful. The other thing I also think is really important, and I think some people, especially in my profession, take this a little bit too far, but you want to try to live with nature instead of against it. And that means having an understanding of it, understanding how it works. And I think some people in my profession take it too hard because it's like, oh, well, that means everything natural is good for you and everything not natural or synthetic or prescription grade is not good for you, in a sense. And that's certainly not what I'm saying. But what I'm saying is how does the natural world work to improve your health? So, for example, getting some sunlight on your skin is a very healthy thing to do. Going out and walking in the fresh air, using nature, sleeping with the moon, waking with the sun, those types of things. Drinking clean water, as opposed to soda and stuff like that. I mean, that's a real basic level, but living with nature instead of against it, for the most part. And then the other thing is, and I just implied this, is all medicine is considered medicine. You just have to know when to use it, whether it's natural or synthetic. Of course, we want some evidence supporting all of that, but all medicine is medicine, and one is not better than the other. You just need to know when to use one over the other or use both together.
Yeah. And the confidence that you can do that and the confidence that you have the knowledge to use them appropriately and get that instilled.
Right.
Anything else, Keoni?
I think those are the main points I wanted to hit. I'm thrilled. Episode 200. That's great.
Yeah, it's crazy. I do think a big part of wellness is also consistency. And you know, that, and it kind of like truth, it's somewhere in the middle, right? So like if, you know, and this speaks to social wellness and all the different aspects, but if you're unbelievably crazily disciplined to where, you know, your social aspect is kind of falling to by the wayside, that's not necessarily a well thing to do either. And really falling somewhere in the middle. You know, there are times where maybe you're not crazily working out with your HIIT exercises or whatever the case may be, and you're just going for a walk or you're just doing yoga, and finding that healthy balance for you. And again, the answer very much often lies somewhere in the middle. And it's only defined by you as far as what your wellness is.
I think that's a great last point. Consistency is key, right?
Yeah.
So when we talk about exercise, it doesn't matter how much weight you're lifting, it doesn't matter what you're doing and so on, but are you doing it in a way that's going to allow you to be consistent and to do it most days? As far as diet goes, you know, are you generally eating healthy? You know, and every now and then, are you having a piece of chocolate cake? I mean, damn, to me, that's part of health. I mean, enjoying food is part of your health. It's like, you don't have to be, neurotic about that. Having a drink here or there, you know, but in general, are you consistent with a healthy lifestyle? All of that stuff may have some benefit, you know, down the road, and benefit in, you know, for example, I just give a crazy example. I tend not to really drink. I mean, I'll have a cake, maybe a glass of wine or half a glass of wine, maybe once on a special occasion. But you know, people who through social interaction like to have a drink with friends and stuff. I mean, that enhances that. That could enhance that. It may be good for you, but in general, you know, are you taking it overboard, or are you
it's always somewhere in the middle, or moderation?
Right. Yeah, it's moderation. I know that, and that's different for everybody, you know.
Right.
Definitely. But you know, moderation is different for everybody. So it's just like, how do you know you're moderate? Well, part of the reason, and this goes back to one of the things we harped on, Brian, is part of wellness. And I'm a strong believer in this. I know in this society and other Western societies, it's kind of like, well, don't go see the doctor until you're broken. It's the exact opposite, in my opinion. You go see your doctor, PT or whatever, before you're broken, so you don't get broken, you know. So prevention is the best cure. And part of that is seeing your healthcare team on a regular basis, you know, getting your eye exam, hearing exam, getting your annual blood work, or, you know, getting your vitamin D checked every now and then, getting a functional movement assessment every now and then. Those things are hugely important and speak to that prevention is the best cure.
Yeah, maybe if we focus on being well, we'll find that we're just automatically more healthier.
Yeah, that's right.
200.
Yeah. Thanks. Well, anyway, thank you everybody for listening to our 200th episode. Please pass it on to your friends and family if you think they will benefit from it.
Yeah, even if you don't think they'll benefit from it, just send it to them repeatedly every day. Just wake them up with a new text, an episode,
and tell them they have to send it to 1,000 people, and then they have to send it to
1,000. But other than that, awesome to be part of this with you, Keoni, and to be part of this with the listener for 200 episodes. And until next week, be well.
Yeah, be well, everybody. Thank you.